Okay. My name is Ben, and this is my submission for the head to toe assessment. And this is my patient. It's my mom. All right, so come in, introduce myself. My name is Ben. I'm going to be your nurse today, and I'm going to be doing a head to toe assessment. So first, what is your name and your birthday?
Kathy. My birthday is November 8th, 1950.
And your last name?
Seamers.
Okay. Patient is identified. And next thing I'm going to do is provide privacy by shutting the curtain. And then I'm going to do hand hygiene. And the first assessment that I'm going to do is to check her mental status. So what is your name?
Kathy Seamers.
What is the date and time?
It's probably about 1 o'clock, and it's July 24th.
And where are you?
At High Point Health Hospital.
Okay. And what brings you to the hospital today?
Well, I've been coughing a lot, and I'm a little bit worried about COVID.
Okay. All right. So patient is alert and oriented ×4. And the next thing I'm going to do is the whisper test.
Am I supposed to say? Yeah.
Okay. And on the other side.
Whisper.
Okay. Interesting. The next test I'm going to do is a vision test. Can you tell me a couple of words off the menu, please?
It says tacos and mangoes and lemons.
Okay. Now we're going to check for Perla. So shine it in this. I'm going to shine it in her left eye and observe her left eye. I don't know if you can see. I'm going to shine it in her left eye and observe her left eye. Then I'm going to shine it in her right eye and observe her right eye. Now I'm going to repeat it, but observe the opposite eye. Okay? Now look at the pen. Perfect. All right. Pupils are equal, round, reactive to light, and accommodating. And the next thing I'm going to do is check her vital signs, which are going to be her blood pressure, her heart rate, her respiratory rate, her temperature, and her oxygen saturation. And then the next thing I'm going to do for the memory test is just give her 3 words for her to remember later. So the 3 words I want you to remember are window, truck, and paint. Window, truck, paint. So I did all that. And so the next thing that I'm going to do is be checking her respirations and listening to her lungs. And for the sake of this recording, she's gonna remain clothed. But if I was on the floor, I know that to use a stethoscope, that it has to be on the skin directly. And so her respiratory rate and her breathing are normal. Her chest is symmetrical upon inspiration. And so now we're going to listen to the lungs. And for that, we're going to want to use the diaphragm. So I'm going to go on the other side.
Okay. Should I scoot closer to the side?
So the first things you listen to are up top, and inspiration and expiration, breathe in and out. Okay. Then we listen to either side. And now we listen to the batter. Okay. So the lung sounds are clear in both lungs and all 5 lobes. And the next thing I'm going to be doing is listening to her heart. And so for the first time you listen to it, we're going to use the diaphragm. Okay. And the first thing I'm going to listen to is the aortic valve, which is in the second intercostal space on the right side, directly next to the sternum. Okay. And the second one that I'll be listening to is the pulmonic valve, which is in the second intercostal space on the left side, directly next to the sternum. Okay. And the third valve I'm going to listen to is the tricuspid valve, which is in the fifth intercostal space on the left side, directly next to the sternum. Okay. And the fourth valve I'm going to be listening to is the mitral valve, which is in the fifth intercostal space on the left side on the midline of the clavicle. Okay. And then I would repeat that, except the only difference is to flip the stethoscope around and use the bell. And upon auscultation, S1 and S2 are noted. The heart has a regular rhythm and there is no murmur. And so the next thing that I'm going to be doing is inspecting the abdomen and then auscultating and then palpating. So the abdomen is appropriate skin color for her ethnicity. It is symmetrical and flat. Now I'm going to be listening. For this, we're going to use the diaphragm. Okay. Bowels are active in all 4 quadrants. And we're going to palpate to see if there's any tenderness. Does it hurt?
No.
Or anything?
No, doesn't hurt.
All right. Abdomen is soft upon touch, non-tender, and there's no distortion or anything. So the next thing I'm going to be doing is starting to check her pulses. And the first set I'm going to be checking are her brachial pulses on either side. Brachial pulses are +2 bilaterally. The next pulse I'm going to be checking is the radial pulse. Okay. The radial pulses are +2 bilaterally. And while I'm at the hands, I'm going to test the musculoskeletal system. So go ahead and squeeze my hands. Okay. Grip strength is strong. Push on my hands. Okay. And pull. Okay. Strength in the left and right upper extremities is strong. And so I'm going to keep checking the pulses. The next two I'm going to check are the femoral pulses. Okay. Femoral pulses are +2 bilaterally. The next one I'm going to check is the popliteal. Popliteal is +2 bilaterally. The next pulse that I'm going to be checking is the dorsalis pedis. Dorsalis pedis is +2 bilaterally. The next one I'm going to be checking is the posterior tibial pulse. Okay. Posterior tibial pulse is +2 bilaterally. The next thing I'm going to be checking is the capillary refill on the toes. Okay. Capillary refill is brisk, less than 2 seconds. And I'm checking for edema. There's no edema. And while I'm thinking about it, one thing I forgot to do is check the capillary refill on her fingers. So let's do that real quick. Okay. Capillary refill on the fingers is brisk, less than 2 seconds. We'll go back down to the feet. And I'm going to be checking the musculoskeletal system in her lower extremities. So go ahead and push and pull. Okay. Lower extremities are strong. And the next thing that we're going to be testing is her gait. So I'm going to just walk to the door and then walk back. Okay. Gait is steady. No use of an assistive device. The next test that I like to do for my assessment is the Romberg test. So go ahead and face away from me and put your feet together and then close your eyes. Okay, you can lay back down. Romberg test is passed. And then, so for the last thing, what are the 3 words that I asked you to remember?
Window, truck, and paint.
Okay. I think that's it. So that concludes my head to toe assessment.